In Good Shape, your health magazine on DW, featuring an interview with a different expert every week.
And I'm with Professor Christian Witt. He's Professor for Pneumonology here at the Charité in Berlin. Thanks for inviting me into your clinic. In patients with COPD, what actually happens inside the lungs?
The main process is an inflammation of the bronchial system related to an enlargement of the lung structures called emphysema.
And what's the cause of this emphysema?
The main cause is cigarette smoking in most of the cases, but in other parts of the world we have a cooking on open fire, and we have now in our regions we have the problem of air pollution in particular in urban structures.
So and if the bronchia are inflamed, what happens inside them? So are they red and is there mucus going on?
The endoscopical picture is a red mucosa. There's more mucus inside, more coughing, and we have a lot of dynamic parameters, functional parameters in the bronchial system.
So, and the patient, do they complain of pain because of the inflammation, or what is the main symptom?
We have three main symptoms: cough, expectoration, and dyspnea at rest and at exercise.
And I guess there are a lot of treatment options. So how do you normally treat patients with COPD?
Most of the patients are treated by inhalation therapy, by inhalers, which containing first bronchodilators and second anti-inflammatory drugs like steroids.
So how good do these medications usually help?
We have efficacy of these drugs. We decrease the speed of the progression of disease, and we have two main molecules which are applied to the patients. At first, we have the bronchodilators, that means enlargement of bronchi, and second, anti-inflammatory drugs, at least steroids, inhaled steroids.
I know those inhalers from my office, from my surgery, and usually I prescribe them to patients with asthma. So what's the difference of COPD and asthma?
The diseases are different between each other. We have a difference from asthma, it's more acute, it's more running disease than COPD. It's a slow progression and slow clinical, slow follow-up. And the therapeutic options or therapeutic options are not so much different. At first, bronchodilation as a principle, and second, the anti-inflammatory treatment by glucosteroids.
And if those drugs won't work any longer, you can even go as far as putting the patient into some kind of lung transplant. So which kind of patients are the patients you would choose for that?
We are looking for patients to get them the perspective for transplantation. In general, the patients are very limited in their capacity, lung capacity. They are limited at the exercise test. For example, 6-minute walk test is very short, and we are looking for patients around about 60 years and less.
We're up the roof of the Charité here right now, and if I look at the machine, I think I'm in the weather studio. So you're a pulmonologist. So what do you do with a weather machine?
Yeah, really a little bit it is. And we have a research project here in the Charité to investigate the relationship between climate change and human health, in particular in lung diseases. And therefore we need that weather station to collect data from the day and over the time of research.
So does it mean if it starts raining or if the weather's getting colder that your patients are getting worse?
No, I think we are much interested in temperature, outdoor temperature, sun radiation, air movement, because we are focused on heat waves or on heat effects on patients with lung disease, to look what has happened, what does it induce in the patient, more disease, more morbidity, and in the end of the day, more mortality. That are our questions. And second, we are investigating the point, how can we adapt to these climate change situation increasing of temperature, increase of heat waves. And so we developed special patients' rooms with a special innovative radiant cooling climatization. And therefore, it is really necessary to have real outdoor data.
And what are your first results from this?
And our first result in heat waves is that the climatization of patients' rooms, we call it a little bit so patient room of the future. It is so that the patient room of the future is able to, that the reconvalescence of the patient goes faster, and he can demit at the hospital earlier than patients in normal patient rooms at the hospital.
We got a viewer question from Thailand. Noko Koyuma wants to know, she's a lady with a lung disease and she's out of breath sometimes. And she realized that if she's in a room on a constant temperature with an air condition, her lung function improves. So should she buy an air conditioning herself?
Most of the patients are feeling a little bit cooler, or smart climatization. That is the issue, smart climatization. Our climatization is about 23 degrees Celsius. It means 72 Fahrenheit. And this climatization is good for patients with illness, for patients with respiratory diseases, and supports enormously the reconvalesation of these patients. Therefore, I support the position of the patient, the feeling of the patient. And in my opinion, looking into the future, we will have more need for climatization, not in all rooms, but some rooms for very hot days or heat waves.
So is it a great idea to care for a certain temperature with no much alterations in the temperature, to protect the body from the temperature changes which appear over a day or over a year?
Yeah, I think both is interesting. Second, the peaks of temperature, very hot days until 40 degrees to 38 in Berlin, for example, that is new, that was not in the past. And second, the volatility of the temperature. That means we have in the morning 20 degrees, and on midday we have more than 35 degrees. Taken all together, that is, I think, the impact on the human health or on the impact of disease for patients.
It's a very interesting field you're doing research in. Thanks for inviting me today into your clinic, and thanks for bringing me up your roof.
Yeah, thanks.